Sometimes what feels like mere tiredness or just a vague sense that something is off is actually a signal that a silent battle has begun inside your body, one you may not even suspect. And if this battle is pancreatic cancer, then time isn't just important, it's almost the one thing we have left very little of. There is a disease that creeps slowly and quietly, as if waiting for the moment when it can no longer be stopped. It's invisible, rarely causing pain in the early stages, not demanding attention or rushing you to seek help. It works differently, growing in the shadows while a person keeps believing they're simply aging, that it's just a bad phase and that it will pass. But it doesn't pass. This disease destroys one of the most unnoticed but vitally important organs in the body, the pancreas. The one nobody thinks about until it's too late. Meanwhile, it controls how your body digests food, regulates blood sugar, and absorbs energy. When the pancreas begins to suffer, the whole body suffers, though at first almost imperceptibly. That's why more than half of people don't realize what's happening until the cancer spreads beyond the organ. And this happens because the first symptoms don't come as alarms, but as everyday routine. Fatigue, loss of appetite, heaviness after meals, strange bowel movements, a feeling that your body isn't digesting food like it used to. Some simply stop eating, not because they're hungry, but because food causes disgust, bloating, nausea, or strange sensations in the stomach. Weight drops, muscles weaken, and even familiar movements suddenly require effort. But the main issue is not this. The main issue is that all this can go unnoticed, or noticed and ignored, day after day, until the disease spirals out of control. However, this silence has a weak spot. Research shows that if you pay attention to just a few of these symptoms at the same time, your chance to catch the disease early increases by almost 70%. This isn't abstract statistics. This is a clear window that is still open. But only if you don't turn away. Listen to your body. It never lies. It never truly stays silent. And if you feel something strange is happening, don't try to explain it away as mere tiredness or age. Sometimes behind weakness lies not just burden, but a real process of destruction. But as long as you feel, you are alive. And as long as you're alive, there is hope. And everyone has the right to know what is happening inside before it's too late. Now, let's take a closer look at each of these alarming signs. Please, take a moment and really listen. If lately you've noticed your strength fading, if simple tasks, like going to the store, a morning walk, even having a conversation, feel overwhelmingly exhausting, this may not just be fatigue. Not mere tiredness, and definitely not just age catching up. Sometimes the body quietly signals something far more serious, and it's crucial to pay attention. There is a particular kind of weakness that silently seeps into daily life. It doesn't lift after rest or sleep. It's like a heavy blanket that makes every breath harder to take. Pancreatic cancer, a disease that often hides in the shadows for a long time, can first reveal itself through this deep, unexplained exhaustion. Because inside, the tumor is demanding energy. It drains nutrients, steals strength from healthy cells, making every day just a little harder than the last. You might wake up after a full night's sleep feeling like you haven't slept at all. Climbing stairs leaves you breathless, a short walk forces you to stop. Inside, there's anxiety, irritation, a vague sadness that words can't explain. Sleep becomes restless, thoughts scatter, and the fatigue only deepens. This isn't just stress. It's not normal for your age. It's a warning sign, and it deserves your attention. Sometimes strange waves of heat and chills appear. Without reason, suddenly you shiver, as if caught in a winter wind, and then an hour later, you feel feverish, like your temperature has spiked. These fluctuations might not be caused by infection but could be your body's response to inflammation linked to the tumor. Especially if the fever comes and goes without a clear cause. Sometimes it's accompanied by night sweats, weakness, and the feeling that your body is fighting a war you never started. Then there's the subtle swelling of a leg, warmth, slight aching. Many might ignore this, but that's a mistake. Pancreatic cancer can cause changes in blood clotting. This condition, called hypercoagulability, makes blood thicker and prone to forming clots. If such a clot reaches the lungs, it can be fatal. Shortness of breath, sudden chest pain, rapid heartbeat, all demand immediate medical attention. But even more important is preventing this by recognizing the early signs. Sometimes symptoms show up in your abdomen. You feel strange tension on the right side, just under the ribs. As if something inside has grown. The pancreas sits near the bile ducts, and when a tumor blocks them, bile builds up, enlarging the liver or gallbladder. This may not hurt or cause obvious trouble, but if you feel a lump or simply sense that something's wrong, it's already enough reason not to wait. Each of these signs alone might seem harmless, but together, they tell a story you cannot afford to miss. Don't be afraid, be informed, be vigilant, listen to yourself. If you recognize any of this in yourself, don't brush it off. Don't wait for it to pass. Don't tell yourself it's just fatigue. Your body is not lying. It's asking for help, and you deserve that help. Please, listen carefully. This is very important for you and your loved ones. If you notice that your abdomen is constantly bloated, as if something inside is squeezing and making it hard to breathe, if after just a few small bites of food you feel full in a way you never did before, this is not just a temporary discomfort. It could be a signal from your body that must not be ignored. Bloating and heaviness in the abdomen related to pancreatic cancer are not ordinary digestive problems. They are a sign that demands your attention and action. The pancreas is not just an organ. It is your body's main helper in digesting food, producing enzymes that break down fats, proteins, and carbohydrates so your body can gain energy and strength. When a tumor begins to grow in this organ, it disrupts its function. Because of this, food is not digested as before, and a feeling of heaviness and constant bloating appears. You may feel as if your stomach is filled with air or heavy weight, and this sensation doesn't go away in the morning or evening. I understand how worrying it is when every meal becomes a challenge, when after eating lunch you feel exhausted and uncomfortable. This is not just overeating or excess. It is a symptom indicating serious changes in your body. And it's not something easily fixed with antacids or diet changes. It is a condition that requires diagnosis and care. Often people attribute these symptoms to age, stress, or common stomach upset. But if this feeling of heaviness and bloating lasts for weeks, does not subside, and does not respond to medication, it's time to be alert. Don't delay seeing a specialist. Early detection of this disease can save your life. Now about the pain. Not just ordinary stomach pain, but the kind that feels deep, pulling, and constant. You may have noticed that this pain sometimes radiates to your back, as if you were being squeezed by an invisible belt. This is not just unpleasant, it is an important signal. The pain intensifies after eating or when lying down, exactly when the pancreas tries to work but is hindered by the tumor and inflammation. This pain is unlike typical stomach upset. It doesn't come and go, nor does it get better with simple treatments. It constantly reminds you of itself, demanding attention and understanding of what is happening inside you. Do not ignore it or suffer in silence. Your body is trying to warn you that urgent help is needed. Another important sign is a change in the color of your urine. Perhaps you have noticed that your urine has become dark, resembling strong tea or cola. This is not just a coincidence. It indicates that the tumor may be blocking the bile duct, and bilirubin, a substance normally processed by the liver, starts to accumulate in your body. This condition is called jaundice and often appears before yellow spots show on your skin or eyes. It is very important not to dismiss this symptom as dehydration or dietary changes. If the urine color does not lighten after several days of proper hydration, it is a worrying sign that cannot be ignored. Seek medical help immediately. This might be your chance to detect the problem early. I understand how frightening it is to hear all this. But there is good news. The sooner you notice these signals and start acting, the better your chances of coping with the disease. Your health is in your hands. Don't let fear or doubt stop you. Remember that modern diagnostic and treatment methods are constantly improving, and timely action can change the outcome for the better. If you feel fatigue that doesn't go away, bloating, constant pain, or notice a change in urine color, this is not a reason to panic but a reason to seek help and care. You are not alone. There are people who can and want to help, and they are waiting for your call. Do not delay. Share this information with those you love and care about. Together you can ensure that no one faces this disease alone. Your attention and actions can be decisive. Know that knowledge is power. Awareness gives a chance for recovery and peace of mind. Please, be attentive to yourself and to each other. Time is your ally, don't waste it. Thank you for listening and caring about your health. Your life is priceless. Remember that timely recognition of your body's signals is the first step on the path to health and new hope. Please, Stop for a moment and listen carefully, this may save your life. Pancreatic cancer is not just a disease, it is a silent and insidious enemy that stealthily steals your energy and strength. Often the first signals seem insignificant: slight abdominal pain, unexplained bloating, weakness that cannot be explained by ordinary tiredness. But these symptoms are a warning that must not be ignored. Time is the most valuable resource in the fight against this disease. The sooner you notice alarming signs and seek help, the greater the chances to stop its progression and preserve your health. Don't postpone. Take care of yourself and don't be afraid to talk about your feelings with specialists. You are not alone in this fight, and today there are methods that truly help. Take care of yourself, listen to your body, and don't let silence become a sentence.